we're going to cover the basics of Medicare, but we will also dive into the changes as well. So that's kind of an overview. The Foundation for Senior Services is an organization that does have a mission and a purpose. So I will read off our mission to you guys that you see on the screen: to provide mature adults and their loved ones with education, valuable resources, and quality services to help seniors preserve their independence and improve their overall well-being. We also want to support and advocate for seniors in need to help ensure that all seniors are well cared for and can age with dignity without consideration of social, economic, and cultural status. Today's presenters, we have myself. So one thing you should know about this Foundation for Senior Services is that we vet out each of our professionals. So each of the presenters today, and Doris, of course, who's going to be assisting us behind the scenes, we are all been vetted through references. We are all licensed, and we really are experts in our field. And that's the difference of any of our members that are part of SSG. They have all been vetted professionals and are really, I consider, experts in their field, whatever that be. Let me talk about myself. I totally skipped that. So I've been licensed since 2012. I really enjoy maintaining relationships with doctors, medical groups, definitely insurance carriers, and local centers of influence. I am a mother of 4 amazing children, and next week I'll be celebrating my 25-year anniversary. And I own Simpler Horizons, which is really a senior-focused insurance agency. So whether you are just learning about Medicare or entertaining possibly changing your coverage, you'll know that if you reach out to me, I will treat you like family. And we have Paul Davis here, who has been licensed since 1984. He also holds 21 licenses in other states. Paul has been voted by readers of the Daily News as Best Insurance Agent for 21 straight years, since 2002. Paul has been recognized as one of the Valley's trusted advisors by the San Fernando Valley Business Journal, and is a 30-year member of the National Association of Health Underwriters, as well as a member of the National Association of Health Underwriters Medicare Advisory Group. Paul is a part of our San Fernando Valley chapter. And if I forgot to mention, I'm part of the West Side chapter. Then we have Andy Hone. Andy is part of our Orange County chapter. He's the owner and operator of Andy Hone Insurance Planning 24/7, a local independent insurance broker in Southern California who specializes in healthcare insurance since 2001. Whether a person is a business owner, individual, or seniors, Andy has experience and expertise to all 3 healthcare benefit categories. And then our wonderful moderator here, Doris, is part of the West San Fernando Valley chapter. Doris Ford and Ford Benefits Group help simplify insurance benefits and Medicare. Doris assists individuals who are about to retire or who are turning 65 apply for Medicare. And once enrolled in Medicare, Doris helps her clients find the most affordable Medicare supplement or Medicare Advantage plan that fits their needs. Doris and Ford Benefits Group serve California, Nevada, and Texas, pretty much all of the Valley, Orange County, LA County, San Fernando, San Gabriel, and Riverside counties. Doris is a Valley girl at heart, but lives in the other valley, San Gabriel Valley, with her husband of 26 years and her son RJ and nephew Melvin. Doris loves to go to the beach, hiking, and doing salsa. We might have to have like a little salsa academy one day. So thank you to our speakers for joining me today. And we are going to jump right into our presentation because, as I said, we have a lot to cover. Again, please use the chat if you have any questions. I'm gonna show you guys some images, and I have a feeling that you will recognize this. So take a look at this first one. Does that look familiar? Have you seen William Shatner on TV when he's not, portraying his, he's acting here, that's for sure. And then we have another celebrity. Look at that. We've got J.J. Walker. That might look familiar too. Again, actors. And now the most famous one, I think, is we've got Joe Namath. So pretty much what most of you will be recognizing is that these are commercials by paid celebrities to endorse companies and have you reach out to them. And they are promising the world. And we have had a lot of clients misled or misunderstand when they call these companies. And it's actually caused a huge shift in the last 2 years to the way that us independent brokers can now work with our own clients. Besides the fact that, and I'll go into this in a minute, it's actually changed a lot of the way that Medicare members are being supported because they are being confused. These commercials are misleading, confusing, and at the end of the day, Joe Namath really doesn't care what Medicare plan you're on. He is just a paid celebrity, paid by this organization to get you to call them. So I want to show you something that Paul actually put together, which I think is adorable. This is really what Medicare looks like. Medicare is a maze. It's a maze of options. And you are standing right there, right at that door, trying to figure this out. When you call one of these call centers, you'll be lucky if you get somebody to actually walk you through this maze properly. What more likely will happen is it will be a straight line down the middle, directing you to the plan that they want you to enroll in. So it's really important for you to work with somebody who has the experience to guide you through it and then be with you all year long. So when you call these, and hopefully you don't, but if you ever do call these marketers, you'll never hear from them again. And so that's really the difference with everyone on this team. They do care about each and every member, and you will hear from them throughout the year. So let's talk about the facts. This is what happened because of those commercials. In the last 2 years, there has been an increase because of these misleading marketing from 15,500 to over 39,000 grievances and claims that and complaints to Medicare. I know I get the calls that my clients call me and say, I don't know what happened. My insurance card, I just got a new insurance card in the mail and I don't remember signing up. That's happened multiple times. People are harassing you over the phone and your mailbox, I know, is full of solicitations. So what you really need to think about is, do they really have your best interest in mind? The difference between us, we have spent hours, hundreds of hours, every single year, learning about the different products and learning about how Medicare is changing. Part of the presentation that you'll see today is we will talk specifically about those changes. And we guide you, we represent multiple carriers in your community and in your area. We don't work for one specific carrier. So when we speak to you, we're going to talk to you about what we feel is, we're going to basically guide you. You know, we listen to you, we listen to your, what's important to you, we listen to your concerns, and then we help you, guide you to what we think might be best suited. And the one thing that we are required to now tell you is that we don't represent every plan out there, which is true. If you've gone to Medicare.gov, you will see like thousands of plans throughout the US. It's just, it's a crazy amount. It's impossible really for one person to be able to represent every single plan that's available throughout Medicare.gov's site. However, and I know everyone on this team does this, if there is a plan out there that we don't work with, we will let you know. This is not a plan we work with, but this is really going to be better for you. And that's not something that you'll get by calling any of those toll-free numbers. So with that in mind, I'd like to kind of start the presentation with just some of the basics of Medicare. Even if you've been on Medicare for a long time, or if you're just getting started, it's really good to just have a baseline of what Medicare actually is. And from there, we can talk about your options and the changes as well. So what I will do is I will have Andy take over and talk real quick about, well, who needs Medicare to begin with? So with that, Andy, the stage is yours.
All right. Thank you, Elka. Good morning, everyone, and happy 57th anniversary to Medicare. Medicare started in July 30th, 1965. And so the easy way to remember is that Medicare was designed for people who are over 65 or turn 65, or in case people who has disability receiving SSDI for 24 months, they also will qualify for Medicare. And turning 65 is a big milestone in your life, and so things are changing. And one of the things also changed is that since 2014, when Affordable Care Act came out, in California, we call it Cover California. And if you are with the tax credit with subsidy, if you are eligible for Medicare, you will not be eligible for tax credit anymore. So one thing you do want to keep in mind, because sometimes people will say, well, I have this great plan, I'm getting thousands of dollars. Well, if you pay and you're eligible for Medicare, then you will need to transition to Medicare. Now, also with people, a lot of people are working beyond age 65. And one thing you need to remember is that if your company is less than 20 employees, then you are also need to enroll Medicare. Why? Because Medicare will be the primary payer. And once you're primary, that means they're the first in line to pay for this. So make sure you do that. Now, if you forgot about it, unfortunately, there's always people forget about things. And there is a penalty for the Part B. Every 12 months you missed out. And there's also Part D prescription that you also missed out. Okay. Go ahead, next slide. Now, so who does not need to enroll Medicare in age 65? And that's basically, if you're still working and working an employer with more than 20 employees, then chances are you have what's called credible Part D coverage. You do need to make sure that to verify that it is credible. And then if and when you leave your employment, you need to take that proof. And so when you show Medicare that your Part D, your prescription part, is as good as was what when you were eligible at 65. And unfortunately, also there's some people who enroll that when they should not, and paying the Part B premium that it shouldn't have to. So you have a question about when and how to apply, and this is how we are the local resources here to help you out. So thank you. That's my portion, right? Go ahead.
Thank you, Andy. Yes, so I'm going to really quickly show you guys just the parts of Medicare. So sometimes you hear someone say, oh, well, I just have original Medicare. Well, what does that mean? So right here, you see really easily Part A and Part B, that's it. Those are the two parts of original Medicare, nothing else. Now, what you'll notice is there are, at the bottom, you have two options to supplement or to basically to supplement, although there's a plan called a Medicare supplement, so it's a little bit confusing. But you have two ways to supplement your original Medicare. Really quick, I'm going to go into Part A first, and we'll go into the details of ways to supplement your Medicare to fill those gaps of Medicare. So Part A, the way you want to think of it is anything where you're spending the night, anything where it's overnight. So that is if you're staying overnight in the hospital, skilled nursing, hospice, some home health care. If you're overnight in the hospital, inpatient, that falls under Part A. Part B will be anything outpatient. So Part B is what you're going to generally be using most often. That's going to be your doctor visits, lab work, x-rays, even outpatient surgery. If you have cataract surgery and you're in and out the same day, that's going to fall under Part B. Also, there are some Part B, like chemotherapy or medications that are administered in a doctor's office, that would fall under Part B as well. So sometimes people think of medication that must be a drug and falls under Part D. No, if it's administered in a doctor's office, generally that would fall under Part B. Now Medicare A and B have Part A. If you've worked in the U.S., for at least 10 years, you've earned 40 credits. You've earned Part A at no cost. Part B does have some costs. So I will hand this over to Paul, and we will go through the costs of Medicare.
Thank you, Elka. So for most people in the United States, going into 2023, like 90% of the population, you're going to pay the base amount, which is $164.90. That's actually a slight reduction from this year. And the reason that happened is that for 2022, a new Alzheimer's drug was coming into the marketplace, and they thought there would be $80 billion or so spent on that. Turns out the drug didn't work so well. So they're finally reducing the Part B, as in boy, premium down a bit. When I talk to people about Medicare, this is one of the first things that I bring to their attention, because most people have no clue that Medicare costs anything. And when I talk to someone that's a higher income earner, and oftentimes it'll be someone, well, we're thinking about coming off the group plan. We're not sure when, give us the options. And well, what was your modified adjusted gross income 2 years ago? They hardly ever know that. But once they get it, I say, well, okay, well, your income was over 366,000. So for both of you, your Part B premium is going to be $527.50 a month. How much is it costing you to be on the group plan? And oftentimes it'll be a smarter thing for them to milk the group plan, stay on the group plan longer, because it's less costly to them than enrolling in Medicare Part B as in boy. The other attribute I also always look at, though, is what's the out-of-pocket maximum on the group health plan, because sometimes that will make the difference. Okay, next slide. Okay, so when people first enroll in Medicare, if they're not working with an agent such as myself or the other people on this webinar, they get a bill from Medicare and they just pay it. Well, if someone has had a change in circumstances, a life-changing event, and most commonly the people we talk to, they're coming off of a group health plan, they're no longer working, or they're cutting back the number of hours significantly, there's a way to appeal that. And I'll share with my doctor last year said, okay, my wife's going to be retiring and we need to get on a Medicare supplement plan. Okay, first thing you do is you need to enroll in Medicare Part A and B. Oh, we did that 4 years ago. Oh. And I thought he had wasted tens of thousands of dollars on Part B on he and his wife, because turning 65 and being covered by a large group plan, you don't need to enroll in Medicare Part B. So if someone is going on to Medicare, and they're a high income, they get a letter from Medicare that says you're paying the standard amount. Some people think, great, we skated, they didn't catch it. Then there'll be another letter that says, now we've matched it up with your tax return, and now you owe this much. At that juncture is when the person should file the SSA 44 form and ask to get their IRMA reduced. And every client that I've had do this has had it dropped at least one bracket. You have to check off one of the specific 8 boxes on the form. So if you know anyone that might qualify for this, they should take a look at that form. You can search it, Google search it, and find it. And if you do nothing, eventually Medicare will, based on your new tax returns, will adjust your premium based on what bracket you're in. But it could be a 2-year lag time before that happens. Okay, next slide. Okay, so the gaps in Medicare, if all you have, and I've had this, people, well, Paul, I've got Medicare, why do I need anything else? Okay, so if all you have is Medicare, it's very good coverage. But if you go in the hospital, you're going to have a $1,600 deductible that covers you the first 60 days. If you're there one day, that's not too good. If you're there 60 days, that's not bad. If you're in the hospital more than 60 days, then your share of cost is $400 a day. If you're there more than 90 days, your share of cost is $800 a day. And Medicare will only cover you 150 days. Now that sounds like a lot, but I've had 2 people that have blown through that 150 days and got a call from the hospital asking them how they're planning on paying for the full amount of the care. So Medicare supplement plans fill in all those deductibles, all those co-insurances, and they add an additional 365 days in the hospital. Similar skilled nursing facility, Medicare covers the first 20 days. After that, you'd be responsible for $200 a day if all you had was Medicare Part A and B. Medicare supplement plan picks that up, so you have up to 100 days, no cost in a skilled nursing facility. So Medicare supplements fill that very, very effectively. Other areas that you have, Medicare itself has no coverage for outpatient prescription drugs. Does cover injectable medications administered in a doctor's office or infusion clinic, but not a drug you'd pick up at a pharmacy. Medicare covers 0 outside of the United States. Medicare supplements and Medicare Advantage plans usually offer emergency coverage outside of the US. There's no hearing aids, routine eye, and lots of the things that you hear advertised on the TV commercials are not part of original Medicare. And that's one of the sales pitches that they often throw at you. Okay, and the next slide goes back to
me.
Elka.
Yes, thank you, Paul. So now that we know the gaps of Medicare, obviously we know that just having original Medicare is not enough. So you do need to have something to supplement your Medicare with. You have two options here, and it can get a little complicated. I will try to simplify it. The way that I like to think about it is, if you look at option number 1, that will be your flexibility. Option number 1 is a Medicare supplement plan. So sometimes you'll hear of it called as a Plan F, Plan G, Plan N. There's all these different letters. That is your Medicare supplement plan. And as Paul said, it picks up most, if not all, the gaps of Medicare. However, it does not cover any medications. So in addition to that Medicare supplement plan, you need to have a Part D plan. I'm going to allow Paul to go into details of exactly what a Medicare supplement covers, but just the basics is, if you want the flexibility to see whatever doctor you want anywhere in the US and keep your Medicare primary, then you'd want to go with option 1. Option 1, with that flexibility, you are going to have premium to pay. Nothing is free. So if you want the flexibility, you're going to have to pay for it. Option number 2 is a Medicare Advantage plan. That's your affordability option. You cannot have both these options, by the way. You have to choose one or the other. So that's something that sometimes people are like, well, can't I have it all? No, you can't. You got to make a choice. Option number 2, that is, like Paul said, a lot of the advertisements that you see on TV, those are going to be advertising Medicare Advantage plan. It's not a bad option. It's just an affordable option. And you need to, the key is it takes over your Medicare. So Medicare is no longer primary. And we will hear from Andy soon more descriptions about a Part C plan and what that would entail. But just a quick overview, it will cover your drugs all in one. And generally it will have low to no copays at all. And these are the plans that include all your extras, like the bells and whistles, you know, dental, vision, hearing, all that stuff. And I will say the key, if you want to go with the affordability option, is to make sure that you're with a strong medical group that can support you. So we are blessed in California to have in our backyards just amazing medical groups, top quality, top in the US. So really, it's not a bad option. It's just about what is best suited for you. So with that, I will hand this back to Paul to go into a little more detail about what Medicare supplement plans do on that option 1, again, flexibility option. Go ahead, Paul.
So one of the confusing parts of this is that Medicare supplement plans are the same thing as Medigap plans. 2 terms to describe exactly the same thing. And we all know in the business, they didn't use terminology in the best possible way and manner to keep people from getting confused. So the best attribute of a Medicare supplement plan is, as was stated, you can go to any Medicare contracted provider anywhere in the country. You don't have to get a referral from a primary care doctor. You don't have to meet extra criteria. If they're contracted with Medicare, you can access them. There are presently 10 Medicare supplement plans available nationwide. And these are all highly standardized. So the plans currently on the books are available are plans A, B, D, G, K, L, M, N, C, and F. You go, wait, isn't there also a Medicare A and a Medicare B? Yes. So there's another use of the letter of the alphabet that just makes things more confusing. Those plans are, by the federal government, absolutely standardized. The most popular plan, the plan that I'm mostly enrolling people the last 2 years, has been Plan G as in George. If someone is on a plan F as in Frank, they can maintain it, they can change to other plans, but anyone that got Medicare after January 1st, 2020 is excluded from getting a plan C or F. They didn't want people after January 2020 having a Medicare supplement plan that had no deductible. So Plan G does have a modest deductible. If you're on a Plan G, it's the same identical benefits anywhere in the United States. They have to all be the same. And that derived out of in the early 70s and 80s, carriers were coming out with very specific plans. And I remember reading about people that had signed up on 6 or 7 different supplemental plans because unscrupulous insurance agents had talked them into it. So that doesn't happen anymore. So this fills some or all of the gaps. You can go to any Medicare contracted provider anywhere in the country. Again, they're very standardized benefits. Just to give an idea, if you're in the Los Angeles area, the cost for Plan G ranges from someone that's just turning 65 at $121 a month to someone who's over 85 at about $288 a month. So there is a component to age. Next slide, please. So again, Medicare supplement plans do not cover prescription drugs. So one of our joys is we've got about 1,500 Medicare supplement clients. And during this time of year, October 15th to December 7th, we offer to reshop their Part D prescription drug plan to make sure they're on the right plan for next year. The drug plan can be purchased independently, or some people have Veterans Administration or other coverage that would be considered creditable and they don't need to sign up on it. Next slide, please. So again, you can stand standalone or as part of a Medicare Advantage plan. Presently in California for next year, there are 26 Part D prescription drug plans. They range in price from $4.50 to $172.50. So quite an incredible range of prices. And I know some clients that have shopped this on their own and they've chosen the plan with the lowest monthly premium. And only when they started the plan the following year did they discover that some of their drugs weren't covered. So this time of year, it's really important for anyone on a Part D prescription drug plan to look at their options and make sure they're on the better plan going forward for next year. And let's see, next slide. So what I gave you before was the premium amounts for Part D. But if you're a high income earner, you also have an income related monthly adjustment amount, or IRMA. And this is in addition to the Part B premium and Part B IRMA. So you can see if someone's in the income bracket 366,000 to 750,000, they're going to pay $70 a month in IRMA plus the plan premium, and they're going to have the higher Part B as in boy premium. Next slide. So Part D has a lot of moving parts. So you could have the same drug on the same plan and pay 4 different prices during the calendar year. It's always a source of confusion. So on the left-hand side, we start with the deductible stage. Most Part D plans have a deductible, and next year that deductible is $505. Most Medicare Advantage plans that include drug coverage do not have a deductible. The second tier is initial coverage, and that's usually a fixed dollar copay or a percentage of the drug's retail price. Then once you've purchased drugs with a retail value of $4,660, not what you've spent, but what the retail value is, you go into the coverage gap. Used to be called the donut hole. I like that term, but they've sort of gotten rid of that. And then the next phase is once you've purchased drugs with a retail price of $7,400, you're into coverage gap, where you're going to have a low copay, but no more than 5% of the retail price of the drug. And then every January 1st, this cycle starts over again. There's always changes to the deductible and other aspects of the underlying plan, but everything cycles over again. Okay, and then it's back to
Andy. So I will, Andy, you will now take over, and I will allow you to explain to us that option 2, which was the affordability, Part C.
Thank you, Paul, and thank you, Elka. And if you thought that was the hard part, we'll wait till you come to this part. Paul has the easy job, actually, because as he said, all the Medicare plans are standardized. So a Plan G is a Plan G. So that's the good part. Now, what I want to introduce you to is the Part C. Now, just like Medicare, also known, they have 2 names for it. There's a Part C and Medicare Advantage plans, and these 2 are the same thing. So 6-pack, half a dozen, that means the same thing. So what is the Part C plan? Well, Part C is a private contract that combines Part A and B. And if you want to, and most of them do include Part D, and they have an acronym called MAPD, Medicare Advantage Prescription Drug Plans. And the key word here is managed care network. And when we think of this way, think of your cell phones, right? You may have Verizon, T-Mobile, AT&T, whatever, network matters. And most of the MAPD plans are HMO. So by definition, an HMO is that you have a PCP, primary care physician, your family doctor. He or she will be the person that's taking care of you. And any kind of needs you have, you will go to that person and they can take care of you great. If not, they will be responsible to refer you to the specialist within the network. I keep using the network because it's extremely important. Now, I think a lot of time, 99% of the seniors I talk to, there's, oh yeah, I have this PPO plan. Actually, what they're referring to is that they have a supplement plan, what Paul just spoke earlier. Because what PPO and HMO have in common is the network. Sure, the PPO, you have the flexibility of going in within the network or outside the network, but you are going to pay more. With the Medigap, there's only one price. You just ask, do you accept Medicare assignment? So like I said, Paul has an easier job. You go with what the plan he recommends, make your life a whole lot easier. So why would people want to go to this kind of confusing Part C plan? Well, there's several reasons you see right here on the bottom. And what Elka represented earlier, affordability, right? So as you can see, there's a low or no premiums plans. We'll never say the plan is free because there's somebody's paying for this. There's no free lunch. However, because we're in the LA Orange, the greater Southern California area is extremely competitive. And the insurance company, basically, they have a private contract from the Medicare, and they decide what is best for the market. And I'll give you a couple examples. Now, maybe you're new to Medicare, and you still have a very active lifestyle. So a gym membership for you, that's very valuable. Well, a lot of them have a gym membership, include some of the premier ones. The monthly fee may be costing $200, $300 monthly gym membership. They do cover that. Now, some people say, you know what, I'm overall healthy, but I need some lot of dental work done. Or there's plans that are strong on the dental benefits. And I have some of my clients, as they get older, they became more frail, and they develop some chronic conditions. Well, there are chronic plans, for example, diabetes plans that offer $0 insulins. These are MAPD plans. And finally, people who may be in their memory care or in nursing homes, it's no longer feasible or possible or safe for clients, for the seniors to move in and out of the nursing facilities. So there are special MAPD plans, institutional plans, where they have doctors and nurses come to see the seniors and take care of them on their facility. So these are some of the examples of a Part C plan, also known as Medicare Advantage plans. And obviously on the very bottom, I think Elka mentioned earlier, the original Medicare only covers Part A and B. So no prescriptions, no dental, no vision, no hearing aid. Ironically, these are all the things we need as we get older. And these MAPD plans may be suitable for you if we understand your situation. That's why we are the local resources and understanding how this works. And more importantly, as Elka mentioned earlier as well, your medical group is extremely important. Just because the building says this name hospital, but there are different medical groups operating within this hospital. So you do want to make sure you work with someone locally and not at some 800 numbers, because we live here, we work here, and we know the doctors and medical groups here. Okay, next slide, please. And you say, oh, Andy, that's great. I'm ready to sign up. Well, hold on to your horses because there are a lot of acronyms: AEP, IEP, OEP, SEP. Oh man, what are all those things mean? So simply put, remember we said earlier, Medicare, you're eligible when you turn 65. In fact, they allow you to 3 months before your birthday, the month of your birthday, and 3 months of your birthday. This is called IEP, Initial Enrollment Period. This is a time you're gonna feel like you're like a prom queen because everybody's gonna bombard you with the marketing materials, sign up here, everywhere, because that's the time you can go to the plan, any plans with no medical question asked. So extremely popular and extremely important that you enroll when you should be, okay? Now, we mentioned earlier about, oh, we're in the middle of the AEP. So if you can see on this picture right here, October 15th to Pearl Harbor Day, December 7th, there's 54 days of the year where those of us who are in this industry, we don't sleep, we don't eat, we don't see our family because we're here to serve you. Because why? Because this is the time for people who already have an MAPD plan, the Part C plan. This is a time you either want to change to an HMO to the HMO, HMO to a PPO, PPO to the PPO, and your prescription, right? The Part D plan, this is also the time you make changes. So if you have a supplement plan from Paul, you don't do anything with that, keep it as it is, but you want to review your prescription plans because everything resets on December 31st, and then January 1st comes around, your prescription comes reset again. And this is what he mentioned earlier about the coverage gap, because it's for us to make sure, look ahead when and try, if all possible, to avoid the coverage gap as far as we can as possible. Now, obviously, life is not perfect, and there's things that happens. For example, people retire, they move, they receive financial assistance they get from Medicare, also known as Medicaid, or they maybe have the disability situation. Then they qualify what's called SEP, Special Enrollment Period. And this is where you can enroll during middle of the year and don't need to wait until AEP, which covers Halloween, Thanksgiving, and almost to Christmas. So you really want to take care of your Medicare before your Thanksgiving chat here. Okay, go ahead. Next one, please.
Okay, so we're gonna, thank you so much, Andy. So the only thing I want to mention is just that January to March period. That's going to be an additional period that if maybe everyone went to Greece during the annual enrollment period and were on vacation and totally forgot to make a switch for Medicare Advantage, there's still one more opportunity, January to March. But what you'll notice is Andy did not mention anything about a Medicare supplement enrollment period. So with that, I will pass it back to Paul to talk about when can you actually enroll in a Medicare supplement. So Paul, take it away.
Okay, so Medicare supplement behave completely different than Part D and Medicare Advantage plan. You have an initial eligibility when you first enroll in Medicare Part B. That can be either at 65 or some later date. And I get calls from people all the time turning 65. Don't I need to enroll in Medicare Part A and B right now? And if they're working for a large company and they've got great benefits, they don't need to enroll in Medicare Part B. So they postpone that till the time they leave the company. And that's the time that they can enroll. If you're enrolling during the enrollment period where you're new to Part B, there's no health history questions whatsoever, and you can pick any Medicare supplement plan that you want. Next slide, please. Okay, so in addition to that initial enrollment period, first 6 months after you get Medicare Part B, there was a few others. Now, a lot of people that I talk to really think that during this time of year, the annual election period, October 15th to December 7th, gives them the opportunity to enroll in a Medicare supplement plan every year. That is absolutely not the case. It has never been part of the annual enrollment period. There's no annual guarantee issue, at least not in California. I think there might be a couple of states that do have some options, but you have to, if you don't sign up when you first get Medicare Part B, the only time you're guaranteed issue is during certain special enrollment periods, and this would be loss of group coverage. You terminate employment, you lose your group health plan. That lets you get in on Part B and also sign up on a Medicare supplement plan. If, say, someone's in California, like this is happening about once a week. Someone in California with high priced real estate, still high price, sells it, moves to some other state. They're on a Medicare Advantage plan in California. They move to another state. They have no idea where they're going to go to see a doctor or hospital. But by moving to another state and moving out of the service area of their Medicare Advantage plan, it triggers a guarantee issue to get onto a Medicare supplement plan. In California, and I thought this was nationwide, but I just learned recently it's very specific to California. If you're on a Medicare Advantage HMO plan and they have a change of more than 15%, either the cost goes up or benefits go down, that triggers a guaranteed right to get onto a Medicare supplement plan at that point in time. Loss of Medi-Cal is another one, and there are several other guarantee issue situations. They don't come up that frequently. But the main point is you can't make this change during the annual election period. At this moment, there's one carrier. I don't know, am I allowed to mention a carrier?
You can just say there is a carrier.
All right, there is a carrier that's currently having what they call an underwriting holiday. And they're accepting anyone onto their Medicare supplement plan for effective dates of December 1st or January 1st. No health history, no underwriting. All you need to have is Medicare Part A and be in California and not be a current subscriber of that particular company. So we've salvaged a number of people, and I had one especially that was under age 65 that had been turned down by every place she'd applied for, and we were able to get her onto a Medicare supplement plan on a guaranteed basis for January 1st. And is that the next? Okay, then that's all of I've got on this one.
Yes. So we've gone through a lot right now. We went through the differences of, when you should sign up, who needs to sign up, why should you sign up, the gaps, how you fill those gaps. We've gone through a whole bunch of details. There are so many options. And as I mentioned, all of us really have spent hours and hours training on understanding options and if you should or should not apply, if you should or should not continue or get started with Medicare. And we've even had situations where somebody started with Medicare and then went back to work and they were offered group insurance through work and they were able to drop their Medicare and then get back on when they retire again later. So really having somebody to guide you is very important, and knowing that you have somebody that you can call, text, email is very important too. So as you have questions, you definitely can use the foundation's resources as well as the experts that you see here today to help you. So just a quick recap is you have two main options: the flexibility option that comes with a premium and allows you to see any doctor anywhere in the country. And I really am sorry about my dogs right now. And then you have the affordability option. So if you can't afford a Medicare supplement, you do have the option to go into a Part C plan, which will include your drug coverage as well. During that consultation, just to give you an idea of what will happen when you meet with a Medicare broker, they analyze everything. They talk to you about you and what's important to you and your family. And something to note is that everybody is different. So my little pet peeve is when someone says to me, but my neighbor told me that they're on this and this plan, and isn't that the best? The best doesn't exist. The best is what is best suited for you. So you can be a husband and wife that live in the same house, and each of you can be on two different plans. And I even had that where I had a husband who had a lot of need for care, and he was seeing multiple physicians for his situation. For him, it was better to be on a Medicare supplement plan. But the wife, who was in pretty good health and really wanted to save on cost, she chose to go on a Medicare Advantage plan. So really, and as Andy mentioned, depending on your chronic conditions, you might choose a totally different plan than anyone else. All of you have different medications. Some of you don't take any medications. So it's really about knowing who you are and what is specific to you so that we can really guide you better. Ultimately, it's something that we do together and you choose. So we give you the options, but at the end of the day, it's your choice. However, we would help you with the enrollment part, and we would help you, again, as I said, throughout the year. So these are just some of the expectations that you could expect if you do reach out to any of our vetted professionals here. I also do want to mention, and I should have mentioned this on the very first slide when I had all the celebrities there, is Medicare and Social Security are not picking up the phone and calling you. It's not happening. And they are not asking you to give you, for you to give them your Medicare number over the phone. If you initiate the call, that's different. If you are calling Medicare or you're calling Social Security, that's going to be different. Be very wary of anybody who is disguising themselves as a Social Security representative. Also, make sure that you're really going through your mail that you get, because a lot of the mail that you receive looks very formal and government official. So you really want to make sure that it's coming from Social Security Administration, or if you're on Medi-Cal, that it's coming from the state. Don't, just give if somebody calls you, my rule of thumb is get their number and see if you can call them back. Because generally, if it's a telesales or if it's a solicitor, They just care about the sale on the spot. They don't really want you calling them back. So just be very wary. And if you have any loved ones who have Alzheimer's or dementia, please take their Medicare cards away and store them somewhere safe, because I've had twice this year, and this is just me, like I don't have as many clients as Paul does, or as any, some other places do. But I've already had 2 members that had dementia who didn't understand what they were doing. They got a call from someone and they just gave their Medicare number over the phone, and their entire healthcare was disrupted. And then we had to spend hours and hours, and that part of those complaints that you saw in the beginning are really because of these misleading representatives who really are not looking out for the best interest. So somebody who really doesn't understand very well, and even those that do understand sometimes get tricked. So just be very careful with your Medicare number, and don't just hand that out to anybody. Really, you shouldn't be. You should kind of be stored away as much as you can. You generally don't need to have it out.
Elka, if I can remind everyone that brokers do not charge members a fee to assist
thank you, Doris.
So we do get paid by the insurance company. So don't let that stop you from reaching out to a local broker or one of us. Thanks.
For sure. And also, thank you so much, Doris. I'm actually so grateful for you for reminding me. We do get paid. We don't get paid by you. We don't get paid by members. We get paid by the carriers. And generally that payment that we get is standard. So it doesn't matter if we enroll you in ABC insurance or XYZ insurance, we get paid the same, and we get paid annually to service you. So if you don't know who your broker is, you really should, figure it out. They should be reaching out to you every year. Like Paul said, every year we're reaching out to every single client and making sure that we're doing those reviews, because we get paid every year to do that. And so we want to, offer you that service and make sure that you're being handled all year long, not just when you initially enroll. Okay, so I will leave it to Andy now to discuss the changes for Medicare for next year. And if any of you still have questions, please do put them in the chat. We'll get them to them shortly. But Andy, please, if you can talk about what is changing for next year.
Sure, thank you. One thing I mentioned earlier is extremely important. If you noticed that if you have your Medicare beneficiary, you no longer recognize the numbers on the card, because in the old days, it was basically your social security number plus whatever letter on the back. And that is so easily guessed or stolen and stuff. And this is why Medicare came out and make sure they have a new ID on it. That being said, because what I mentioned earlier, when you enroll into an MAPD plan, Medicare Advantage plans, your insurance company is the payer and the responsible party. So you do not need to carry, you should not carry your Medicare card out if you have an MAPD plans with you, because that card is no longer useful, because any kind of claims is basically done by whatever insurance company you're with. So keep that in mind. However, if you do have a supplement plan, then yes, you got to carry that card, because Medicare is the primary, your supplement is the one paying secondary, and don't forget a prescription card, because when you go to pick up your prescriptions, that is not covered by Medicare, or the supplement is covered by the prescription plan. So just want to make sure you understand if you have the 1-card system or the 3-card system. Now, regarding changes for 2023, as you can see right here, and we already mentioned earlier, the Part B monthly premium had dropped from $170 to $164.90. This is set by CMS and does not matter which insurance company you eventually signed up, whether it's a supplement or Medicare Advantage plans. What government collects, government gets. So it doesn't make a difference where you go, okay? Number 2, the annual deductible, if you have a responsible for one, like for example, you have the Part G plan G, then it went from $233 annual deductible to $226 starting January 2023. Now, one of the special enrollment is called GEP, right? Beside the AEP, SEP, IEP, there's another alphabet, the GEP. General enrollment period came out when back in the days, or actually always on, is that when people said they did not sign up for Medicare when they're eligible to. Well, what happened is that when you signed up, you got to wait until January, and then you got to wait until July to start your enrollment. So it's extremely confusing, and your penalty will continue to pile up because all the time you're missing. So starting next year, there's good news and there's slightly cautionary news, I should say. Starting in January, there's no longer a waiting period until July 1st. You can actually as early as the month after. But imagine if you call one of us on the 30th or 31st of the month, yes, you can have your Medicare effective the following day. However, you don't even have time to choose whether you want to go the Medigap or you want to go the MAPD plan. So here you are putting yourself in a position where you may be responsible for 20% unlimited gap if unfortunately you have to use a Part B and no prescription. So government do things kind of like heavy-handedly, and you just got to be aware, be proactive on your Medicare timelines. And if you don't know when to sign up or how to sign up, we are here to help you, to make sure you guide you. And this is the value we provide to you and which the service we provide from the community here. Now, lastly, a lot of times people may leave their company and they have COBRA. And COBRA is an 18-month program continuation program, healthcare. But one thing we need to remind you is that COBRA is not, I repeat, not a curable coverage. Now, there is a discussion where they're making that changes, but until further notice, which as soon as we get it, obviously we'll let our clients know if and when a COBRA is about curable coverage. But until then, it's not. So there are cases after cases where people left their employment, they just didn't want to make deal with it, and they're on COBRA for whatever month they're on. And then once they realize, oh no, why am I getting this penalty? Have this insurance. Yes, you had insurance, but it was not deemed credible according to CMS. So extremely important for you to understand the nuance and the timelines of things like this. So I think these, these are the updates for 2023.
Can we address the question in the chat?
We have, let me just go to one more slide and then, or is it related to this, Doris?
No.
Okay, so one more slide. We're gonna take it to Paul to close us out, to just talk about the effects of the Inflation Reduction Act and those effects on Medicare recipients specifically.
Thank you. So this is a really great news, what came out of this act for people. I've got clients on Part D that are paying thousands of dollars a year for their Part D prescription drug plans, even though we've shopped and tried to find them the best thing. So starting next year, if a plan, Part D plan offers, Part D plan or Medicare Advantage plan offers insulin, it's going to be capped at $35 a month. Not every insulin is available on every plan. And the other thing is the quoting engines for Part D and Medicare Advantage plans are not all equipped to reflect this. So if you pick a Part D plan or Medicare Advantage plan, and then January you discover there's a different plan that will cover your insulin better, I understand that there's going to be an open enrollment period for all of next year for that specific reason and that specific purpose, but you'd have to call 1-800-MEDICARE to make that change. Starting next year, there won't be any cost for vaccines. And I don't know which vaccine this incorporates other than shingles. My wife just turned 65, and I encouraged her to get her shingles shot before she turned 65 because I knew there was no cost. But there used to be a significant cost on shingles shot if you are on a Part D plan with the deductible. Going forward, there's no cost for shingles shot. So everyone you know that is at risk, you should encourage them. So starting in 2024 through 2029, Part D plans will have to cap their increases at 6%. Some companies saw next year as their last chance to jack up their premiums. So we had a couple of carriers make some really big increases in their premiums for next year to try to get ahead of this 6% cap. I wasn't happy about that. 2024, great news. People that are on a lot of expensive medications, previously, if you hit catastrophic level, then you're only responsible for 5% of the cost. But if you're on a really expensive cancer drug that's $10,000 a month, that's still $500 a month. So when you hit that cap in 2024, you don't pay anything further. It drops to zero. So that's great news. And in 2025, the maximum out of pocket that anyone will pay for their Part D prescription drug plans is going to be capped at $2,000. We've been hearing that coming for years. And when I heard it was finally passed, I almost did a somersault, but I didn't want to hurt myself. So that's great news for lots of my clients. I've got some that are paying over $10,000 a year for very expensive drug regimens, and this will be a godsend for them. I don't know how this next part is going to work. They're going to list certain drugs each year that they're going to be able to negotiate the prices on. And it's very vague, but hopefully some drugs that are very expensive on everyone's plan will be coming down in price and make it more affordable for everyone. And I think that's all I have on this one. Thanks.
Thank you so much, Paul. And thank you again to all our speakers. If you haven't registered for that, you can go to any of these events, by the way, are found on the foundationforseniorservices.org. All of these, again, are being presented by our vetted professionals that are part of Senior Specialty Group and the Foundation for Senior Services. So I'm sure you got a lot of insight from today's meeting. Any of these are available to all of you to join, participate in, and of course, invite your friends as well. So please go visit the Foundation for Senior Services website, and over there, there's a little button for events. You can see the calendar right there, and then click on anything that works out with your schedule, whether it's in person or virtual. We do appreciate your attendance. And also, one other thing I want to talk about is our telephone companion program. So we actually have amazing volunteers, our call buddies, that will reach out and connect to seniors that maybe just want someone to talk to every so often, to check in with them, see how they're doing. Right now, we have a fantastic group of volunteers that are ready to make those calls, but we really want to have seniors to reach out to. So if you or you know someone that might benefit from having somebody reach out to them every so often, definitely it can change your mood. It can change your day. I mean, I know that I'm going to be putting my aunt on this telephone companion program because she'll really enjoy just getting a call from someone saying, hey, how's it going? How are you doing today? What are your plans? So it makes a big difference just to have someone, especially for those loved ones that, can go sometimes days without talking to someone. So please keep this in mind. And to get more information, the number is right there, or you can also email ssg@foundationforseniorservices.org. You can also reach out to any one of us that are affiliated. We are happy to connect you to the right place. And your feedback is important. We would love to hear from you. We'd love to hear about any programs that you think we could add, any programs that you actually love, something that we could do to improve. We do listen to you. And I think, if I'm not mistaken, Joyce, our surveys sent after each presentation?
We do sometimes send surveys out.
Okay.
Of course, we use volunteers for that, so it doesn't always happen, but we do appreciate the feedback.
So feedback would be great. You can always email any of us. You should have all our contact information on the chat, and we're always happy to listen and to be there to support our seniors. And here's our contact information. Again, I just want to thank really Andy, Paul, Doris, you guys are amazing. I'm happy to have been able to put this together. And I feel like we really shared a lot of useful information. Any questions, again, you can all reach out to us privately, and we're always happy to help.